The difference between prolotherapy and PRP. So both these injections are meant to regenerate an injured tissue, either a joint, tendon, or a ligament. So think, for example, tennis elbow, arthritis of the knee, or chronic low back pain. But the question arises, when do you use prolotherapy and when do you use PRP? Do you use one in the case of acute injury? Do you use one in chronic injury? Does one work better in one case and another one in the other? Most patients don't know the difference between the two. In fact, most physicians don't know the difference between the two, and this is what I wanted to discuss today. So first of all, let's talk about the two differently, the two separately. What is prolotherapy? Well, prolotherapy is short for proliferative therapy. So think prolo, proliferate, or regrow, regenerate. It's a very simple medical treatment. It involves injecting an irritant solution into an injured or painful area of the body. The solution is usually a mixture of two things: a local anesthetic, like lidocaine, same as what your dentist uses to numb up your tooth, and a substance that causes a mild irritation. A simple sugar is what we use most commonly. So think sucrose, fructose, and dextrose. This dextrose stimulates the body's natural healing process by increasing blood flow and growth of new tissue in the affected area. The new tissue then strengthens the damaged or weakened tissue, therefore reducing pain and improving function. So for example, if you had a stiff knee that you couldn't move before, it improves not only the pain, but also the range of motion, and it strengthens the overall joint. Prolotherapy is used for everything from chronic low back pain to osteoarthritis of the hip, knee, to rotator cuff tears of the shoulder, to labral tears in the hip, to chronic low back pain, migraines, and many, many more indications. Now, how is prolotherapy different from PRP or platelet rich plasma? Well, first of all, we're injecting your own blood back into the injured tissue. So it will take a little bit more time. It takes about 15 to 30 minutes extra, to be specific. So it'll be like your other typical primary care doctor visit. You'll give your blood draw, there'll be a tourniquet on your arm. But the difference is afterwards, we take this blood, we spin it in a special machine called the centrifuge. And what this machine does, it separates your blood into different parts. Our blood is basically made up of different types of cells. And from it, we need specifically the platelet rich plasma, which consists of different ingredients that stimulate regeneration or regrowth. So once we separate it out, we take it out, we isolate it into a syringe, exactly like prolotherapy, and then we use it to re-inject into the body part that is injured. Except now it's your platelets rather than the sugar water. So it's a very simple, very elegant process. And this process has been perfected over the last 20 years to be a very, very efficient process. Now, what should you expect after the injection? Most commonly, people experience mild soreness at the place where the injection is done. But generally, it subsides within a day or two. Most people don't get sore at all. And if you do, it's tolerable. It's something that a little bit of paracetamol, a little bit of Tylenol or Adol usually takes care of. Now, the next important question is what do we use prolotherapy and when do we use PRP? And what is the best indication of one versus the other? Well, it depends on multiple factors, but I like to break it down into three factors. What is the severity of the injury, the age of the patient, and how long has the injury been going on, or chronicity of the injury. So obviously, the more severe the injury is, the more likely we're going to need a stronger treatment. So for example, a sprained ankle, a very common injury, can present in one of three grades: mild, moderate, and severe. In a mild presentation, you basically overstretch a ligament in your ankle. Think of it like a rubber band that stretches but doesn't break. In grade 2 or moderate sprain, you have a partial tear in this ligament, this rubber band. And grade 3, this rubber band basically breaks in half, basically completely breaks. So in the first grade, most people recover quite nicely. And in this case, it is very well treated with 1 or 2 sessions of prolotherapy and some physical therapy. Most people could even recover with physical therapy alone. It just generally takes a long time, and you're at risk for re-injuring in the future, which is why I highly recommend some prolotherapy in this case. In grade 2, we need something a little bit stronger, and we have a choice to make. You could either have 3 to 6 sessions of prolotherapy, or you could choose a stronger option, which is to do 1 session of PRP. It will depend on the severity of the injury, which you have to decide based on the combination of physical exam, history, and an MRI. And finally, grade 3, the ligament is completely torn. Sometimes it's even 2 of the 3 ligaments are completely torn. And in this case, surgery is indicated, because if that ligament is completely torn, there's no way to reconnect the 2 together unless we sew it back together. And we need to do that because we need to prevent future injuries. Because remember, ankle is made up of multiple ligaments, and if there's instability in one, you're putting the ankle at risk of creating instability in other ligaments, in other of these little rubber bands that are holding your joint together. Another good example that I like to use is tennis elbow. So tennis elbow, extremely common, pain on the outside part of your elbow. Typically, the patient does not play tennis. Very classic. And welcome to medicine. The patient typically has tried something before coming in to see me. They've tried maybe tablets, some cream, some oral anti-inflammatories, maybe ice, maybe some band exercises. Maybe they've even seen a physical therapist, and nothing has worked. At this point, when they come in to see me, I have an option for them, and we have usually a little bit of a discussion. Do we do some physical therapy, or do we do an injection? Traditionally, most people, they would be offered a steroid, and that is the 20th century way of treating this problem, a steroid or a cortisone injection. And one of the reasons is because it gives them an instant relief. I would not recommend this option. And the reason why is because on multiple studies, on 1 or 2 year follow-up, with comparing a regenerative injection, prolotherapy or PRP, to a steroid injection, a person who had a steroid injection was at a significantly higher chance of having the pain come back compared to prolotherapy and PRP. So let me repeat that. If you had PRP or prolotherapy, the pain does not come back. If you had a steroid injection, you're at a very high chance of the pain coming back. Now, in this specific case, you might ask me, well, what will you choose? What is better, prolotherapy or PRP? PRP is the stronger option when it comes to tendinosis, tendinitis, so tennis elbow. However, I would start out with prolotherapy in most cases, and the reason why is because it's a good enough treatment. Most people get plenty of relief. It's from just simple sugar water injection. And PRP is not covered by insurance, as opposed to prolotherapy is covered by insurance in UAE. So you get this amazing treatment, and it's covered by insurance in UAE. So that's why in most patients, I would start out with prolotherapy for tennis elbow. Now let's put a variation on this case. And let's imagine this gentleman had this problem for a very long period of time, let's say a year. And on MRI and on physical exam, we find that he's very tender at the elbow and he has a partial tear. So the muscle actually began to separate. And so this is dangerous because, of course, that muscle could separate further and could potentially break completely, requiring surgery, which is what we don't want him to need. So in this case, I would strongly recommend him to get PRP because the research is very clear that PRP is superior. However, the thing that we need to look out for, and the thing that this patient needs to be aware of, is that it will take time for this injection to work. Instead of a few weeks, it will take up to 2 to 3 months for this injury to heal. So as a general rule, the more severe the injury is, the longer the injury has been going on for, or the older the patient is, the longer it will take for the injection to work. Of course, there are many exceptions to the rule, but it's a helpful guide to keep realistic expectations so that when people ask me, is it going to be, so that they could answer the question, is it going to take closer to 3 weeks for the injury to heal or closer to 3 months for the injury to heal? So it will ultimately depend on the pathology of the injury, on the individual himself. Now let's look at another case. A lady in her 60s with arthritis in her knee. It's been going on for the past 6 years and it's been progressively getting worse. She tried some physical therapy, some oral anti-inflammatory, steroid injection, a hyaluronic acid injection, which is a type of a lubricant injection. All very reasonable option. And at this point, she wants to try something that will give her a more lasting relief. All very, very reasonable. And at this point, the best step to do is to get an MRI or an X-ray to determine the severity of the arthritis. The degree of the arthritis on the image combined with her story will help us decide which is better, prolotherapy or PRP. If the image shows us mild or moderate arthritis, I would recommend prolotherapy because it's covered by insurance. Very, very important factor. And because it works great in mild to moderate arthritis. Now, if MRI or X-ray shows severe arthritis, then I would recommend PRP. Because in the case of severe arthritis, PRP is clearly the superior option in causing regeneration of the cartilage, improving function, and the range of motion of the knee. So there you have it. There's a summary of the difference between the PRP and prolotherapy.